Welcome everyone to another WIC Works webinar offered by the California WIC Association. This is Margaret Aumann, Communications Coordinator for CWA, and we're very happy to have many of you with us here today for what looks to be a very hot topic, medications in pregnancy and lactation, updates for WIC nutritionists. We're glad that all of you have joined us from all over the country, and I think you're going to really learn a lot from our guest speaker, Robert Felix from Mother to Baby, California. I'll introduce him further later, but first I want to go through a few slides to introduce you to our webinar. So today our goal is to learn about evidence-based information about medications during pregnancy and breastfeeding and where you can find that information. Learn about the free services that Mother to Baby California provides to WIC clients and others and the public and to health professionals, and to learn about the referral methods used to ensure that WIC clients are contacted by Mother to Baby California to ensure healthy pregnancy outcomes. We're going to just excuse me, I had a little technical glitch there for a minute. So I wanted to just say a few things about the best practices for using GoToWebinar if you're new to this. Some of you are probably listening on your computer speakers. Just make sure that you don't have any thing interfering, like close any unused programs that might be streaming data, including email and music. We've had some interference in the past, and we're hoping to avoid that today. Also, if you're listening by phone, you'll want to use the phone number and access code that you got in your confirmation email and enter the PIN. If you do have any trouble, go to support.gotowebinar.com. If you are listening by phone, a special request is that you keep other wireless devices away from the webinar where you're listening, and don't put your line on hold. So we appreciate your efforts to keep our webinar free of audio technical glitches. All right, we will be taking questions. I know you will have some by the end of the webinar, and so after Robert has finished speaking and presenting his slides, we'll review his questions and read them to him. So what you need to do is type it into the question box on your control panel, and don't forget to press send. And we'll be doing that. And don't forget, there will be a webinar recording, and the presenter slides will be posted and available for download within a day or two at our website. Those of you who are registered dietitians and wanting to earn 1 CPU for this webinar, you should have registered in advance, of course. And in order for us to have any documentation of your attendance, you must attend for the full hour. And if you're attending as a group, please email some kind of documentation to Megan at msadler@calwic.org. And then we'll be able to send you a certificate via email. If you're new to the California WIC Association, I just want to let you know that we're a nonprofit member organization in California, serving California local WIC agency directors and all supporters. But we do a lot of training nationwide, such as these webinars and the statewide conference. But anything to do to promote and advocate for the sustaining of the Supplemental Nutrition Program for Women, Infants, and Children, or WIC. So we're glad to have you here. We hope you'll explore our website to learn more about us. And now I'm going to turn to Robert Felix, who's our guest speaker here today. He's from Mother to Baby, California, which is with the UC San Diego School of Medicine. He's been a teratogen information specialist, currently doing community outreach marketing for several years. He spoke at our spring conference, and we just thought that we would like to have him back in this forum so that many more people can hear the information he has to share about Mother to Baby California and keeping lactation and pregnancy healthy. So, Robert, with that, I'd like you to say hello, and we'll make sure your audio is working fine, and then I'll switch over to your slides.
All right. Good morning, everyone. This is Robert Felix, and I'm with Mother to Baby California, it's a program that's been around for quite a while now. So if you go right here, we're on the second slide. Okay, so it's Mother to Baby California. I'm a teratogen information specialist. I've been doing this for over 25 years now. And some of you may know our program with another name. We were formerly known as the CTIS, or CETUS, Pregnancy Health Information Line. And before that, we were the California Teratogen Information Service. It's a service that's been offered to the state, funded partially through the Department of Education, and then we get grants and donation. We're based in pediatrics in San Diego at the School of Medicine at UC San Diego, but we service the whole state. We are the first one in the world, or one of the first, and at one point there were about 60 different services set up worldwide modeled after us. How we started was basically a telephone information line. It's free and it's confidential, and now we do email, and historically we only provided information for pregnant moms or to pregnant moms. But we have since moved on to providing education to moms who are planning a pregnancy, and then also moms who've had their babies and are breastfeeding. We provide health information. No insurance or appointment is needed. People can call anytime during our business hours. It's 9 to 5, Monday through Friday, except for holidays. We have a new feature on the California website, and that's a chat line. Almost always we have somebody there during the business hours, but it's not, because it's a new feature and we're understaffed, you may or may not get somebody. But you should give it a try because it's great because you can chat with someone online. Our primary goal is what I've just told you, the service, but we do have another goal, which is doing this mom and baby follow-up. As most of you know, pregnant moms are not part of clinical trials or included in clinical trials, and probably no one would want to do that. But then how do we learn from exposures that women have and how that may affect the developing baby or the breastfeeding infant? So we do this at least for the pregnancy part. We do a mom and baby follow-up where we encourage moms to participate and follow with us or participate in being followed during their pregnancy, regardless of where they're getting their prenatal care. And then once their baby's born, they're entitled to have their baby examined by our pediatrician who specializes in genetics and birth defects. And some of you may have heard of this exam. It's really neat. Our medical director is Kenneth Lyons Jones, who was first to identify fetal alcohol syndrome back in the early 70s. And to date, he is still the provider that we have, our pediatrician, who goes to visit these moms in their homes, especially for those who can't drive, and will travel anywhere to examine the baby after birth, anywhere from, we hope to get them examined within the first year, but sometimes we don't get to see the kids until they're older. Then we also try to look at them from a neurodevelopmental standpoint, where we're trying to determine whether an exposure has caused or is associated with some neurodevelopmental effects. All of this is free if they participate during the pregnancy. Generally, this part of the component, if you were to get this done professionally, it would cost the person about $1,500, but at this time, if they participate, it's free. I lost my page here, so I'm going to go on with my handout. All right, and then we're part of, some of you have heard of OTIS, especially people who are outside of California at the national level, different states. We have Mother to Baby, or OTIS, Organization of Teratology Information Specialists, and I'll talk to you more about or discuss that more briefly later. By the way, we have if you go to Mother to Baby California, mothertobabyca.org, there's a video of this pediatric exam, and I think you should go and look at it when you get a chance, because it's a really neat thing. In about a 10 to 15 minute time frame, the pediatrician would examine over 150 features that even your regular pediatrician is not trained to examine. All right, so you've heard the word California teratogen, and you're probably wondering what that is. So on the next slide, what is a teratogen? Teratogen is any substance that a mom can be exposed to during pregnancy. And simply put, it's something that can interfere with the development of the baby, and can cause a pattern of minor and major malformation. Now, there's also a thing called behavioral teratogen, where it's a substance that can cause something neurological and not necessarily something structural. A good example of this would be lead, where we know lead has been associated with neurological effects, but not something structural. Another example would be alcohol. If the mom doesn't drink at all in the first trimester, but then decides she's going to drink later in pregnancy, that would classify as a behavioral teratogen. So the next slide, what is it that Mother to Baby provides? So we provide evidence-based information on almost anything and everything you could possibly imagine. We may not have good answers to those questions, but it's something that we will field all questions, from prescription to non-prescription medications, vaccinations, infections, diseases and fever, substance abuse, alcohol, tobacco, illicit drugs or recreational drugs, chemical or occupational exposure. If you see below these bullets, there are some commonly asked questions. And I know I put 4 here, but really the most common question we get to this day, whether it's from providers or even the pregnant moms, is it okay to dye my hair? And I think it's interesting that still we get that, and probably because people are dyeing their hair more commonly, and you can do it over, get the solution over the counter and do it yourself. We have a fact sheet on our website, and you can download that handout and even give it out to your participants, and we'll answer that question. So going on to these questions, when is it safe to have a glass of wine only after the first trimester? I think people call, and today we still get those kind of calls where they haven't done anything in the first trimester, but after that they feel a little bit more comfortable asking if it's okay. And I think it's because historically people were told that in the first trimester you shouldn't do anything at all. But this question is kind of interesting because it's like a mom asking, well, I just wanted to make sure that my baby was structurally okay, but I don't really question whether he would be affected neurologically. So it's kind of interesting because, the baby's brain develops after, more so in the second and third trimester. And so, and of course, the brain is one of the things that alcohol impacts the most. Ones that we get, another question we get commonly, especially during the season, the fall, is a vaccination. But this one is a mom who's planning to get pregnant and actually breastfeeding another child, and would like to get the seasonal flu vaccine. And we encourage that, actually, pregnant or breastfeeding, because there is evidence to show that the flu vaccine is actually more beneficial than what they used to think. If you see the third question, do I have to quit taking my antidepressant or switch to a safer drug? I want you to take note that we are not physicians, so we don't provide directive counseling. We don't tell people what they should or should not be doing about their health care. We actually work with physician care plans, so we don't interfere with their plans. If she's taking an antidepressant, is concerned about it, we say you need to talk to your doctor. If she wants to switch to another drug because she's heard one is safer than the other, then what we'll do is talk to her about the 2 different drugs, or the variety of drugs she's named for the condition, and then say, well, this is the information, this is what you need to take to your doctor. Because it's easy to say, well, this drug A sounds safer than drug B, but we don't know her medical condition. We don't know what's good for her condition. So that's why we don't provide directive counseling. Certainly some things we'll do provide directive counseling. Like, for example, if somebody's drinking or smoking, we say you need to quit. But we guide them and tell them why what the concerns are and whatnot. Another one is I've been diagnosed with gestational diabetes. Will my medication cause birth defects? So those are some of the common questions that we get. If you go to the next slide, so when a mom takes a medication or is exposed to the substance, the issue is, well, how much of that does a mom really share with the baby? If you look at that cartoon on the left, it's kind of interesting because it used to be thought that nothing got through the uterus, and so that the fetus was really protected, and if something happened, it was because of, well, historically they used to think that when babies born with birth defects that it was a curse of God or they did something wrong. But we now know, since the identification of Down syndrome and fetal alcohol syndrome, that things can get through the fetus. It's not just genetics. And if you see the pictures on the right-hand side, you'll see on the duplex picture of a baby with a child with limb malformation or phocomelia. That was because of the thalidomide exposure, which thalidomide back then was given to moms as a sedative. And when they had done studies in experimental rodents, they didn't see any negative effects. But when humans started, when they were giving this to pregnant moms to kind of sedate them, if you will, within a year, babies were being born with these defects called phocomelia. And so it turns out that the sensitive species were humans and not the animals. And so we don't, because of that, we don't go necessarily by or counsel moms with animal data, even though we may talk about it. We don't say, well, because it caused a missing tail in the rat, this is what's going to happen in humans, or vice versa. And then if you look at the picture with the alcohol, the 3 beers, that's, alcohol gets so rapidly absorbed in the system that that's why women are told to avoid it. One of the reasons why women are told to avoid it altogether. So on the next slide, as an intro, how much alcohol is safe during pregnancy? And we say no amount of alcohol is safe during pregnancy, and that women should, once they find out, quit or avoid any alcohol exposure. So you see these pictures on the alcohol, and it's a variety of things on the slide. And the reason why I bring this up is because a woman can have an exposure not just for having a cocktail, but if you look at the last 2 pictures, like the over-the-counter medication, like Listerine and NyQuil. I think NyQuil has changed its formulation, but back in the day, NyQuil used to be about 25% alcohol. And we used to get calls from moms where they say, I don't drink at all. I'd never had alcohol in pregnancy. But when we do this pregnancy questionnaire and ask about medication, we find out that she's been drinking. In the worst case scenario I think I've had was a mom drinking a bottle of NyQuil every day because of the alcohol content. I don't know that is significant because usually when somebody's drinking a NyQuil with a cold, it's only a few times or a few days. But it's different now, so we certainly would address it differently. But the reason why I bring this up is there's this interesting case where about a few months ago, Mom called and she was concerned about an antifungal, nystatin, and I think you might have heard this. It's an antifungal. It could be topical, and it's poorly absorbed, especially if the skin is intact. Okay, but in doing so the mom was really concerned about the nystatin. So in doing so, unlike other services, what we do is we do this whole full-on questionnaire checklist. And so we talk to moms about exposure, and I asked this mom, are you drinking, or since becoming pregnant, have you had anything to drink, alcoholic beverages or anything for that matter? And she goes, oh yeah, I have about 4 to 5 times a week. I said, oh, because I wanted to get a handle on what she was drinking and how much, and kind of see how I can give a risk assessment. And she goes, well, yeah, 4 times a week. And I said, okay, so is it only on the weekends? Is it like a little every day or how much? She goes, well, just on Mondays. And I go, oh, okay, so that's 4 to 5 drinks on one day, which is like a binge. She goes, yeah, because that's my day off. And I said, well, so about how much might you say, you know, like a drink, 2, 3, and she goes, oh, about 4 to 5. And I go, 4 to 5 what? And she goes, well, in one day I will have about 320 mLs, which I thought was kind of strange because she gave me an exact numbers, 320 mLs. So look at that slide, and you see there's a profile picture of a Skull bottle. That's a Crystal Head Skull vodka. And I didn't know it existed, but I was searching info, and I found this, and that's about 720 mLs or 750. So half of that, which is, I think is the illustration here, is how much this woman was drinking a day. Well, she was drinking 3 to 4, maybe up to 5 of the 320 mLs a day, I think is what she was doing. So she was doing a lot, and she was doing it for 8 weeks. So it's interesting because she wasn't concerned about it. She was more concerned about nystatin. So talk about perception. So I ended up counseling her more so on the alcohol and really talking to her at length about the risks involved with that than I did with the nystatin. If you go to the next slide, it just shows you there are 3 things that one must have to get the diagnosis of fetal alcohol syndrome. And I think most of you know fetal alcohol syndrome is a result from drinking heavily. So that's a drinking continuously throughout pregnancy. And the estimated amount is about 1 to 2 absolute ounces of alcohol a day. So that's daily for a prolonged period. Okay? So what they see with fetal alcohol syndrome, that's the concern, is the baby is growth retarded, not only prenatally and postnatally. They have developmental delays, and then they have these specific facial features. Now, what I want you to recognize or appreciate is that these facial features are things that have been seen with FAS or fetal alcohol syndrome, but they're by themselves, they don't mean anything. Okay? So it's just that when they see, when they know there's prenatal exposure, the growth is there, performance is there, and there are some of the facies, then they can say, well, truly say that this kid has FAS. The problem with FAS, or FASD, the fetal alcohol spectrum disorder, if you go to the next slide, is that it's under-recognized. You know, it's difficult to diagnose, especially in the newborn period, or even as adolescents and adults. In our country, there's a lack of expertise among general pediatricians, and there's poor access to experts. And then also when you're asking moms about alcohol exposure, because of the issue of the stigma of being judged, moms don't always necessarily admit things to providers. So I think many of you dietitians or those who come in contact and question or interview your participants, they may say, oh, I've had a drink, but don't tell you the whole truth, again, because of confidentiality. They're afraid of being judged. And it's really a tough one. I think the fact that we are an anonymous service and it's mostly over the phone or by internet, people tend to give us more information than they do their providers. Even if they've established a rapport with the provider, they tend to tell us more. We often get referrals from providers where they refer the moms for one exposure, but by the time we're done talking to her, we've talked to her about 20 other things. Okay? So the next slide, remember that everyone will have questions and that they may not have questions at the time they see you, but they do. And why have them search the Internet? I mean, the Internet certainly is a great resource for information, but you have to be careful because there's a lot of misinformation going around. So it's going to generate, sometimes it can generate more concern than it really needs to be. And so I think the easiest way you could allay that, the fears, is by referring them to mothertobabyca.org. Okay? And then if you go to the next slide, you know, I'm known for showing pictures of babies with birth defects. But since then, I think I've changed my MO because people, well, I got to a point where I think even at the CWA meeting I went to in San Jose, I was walking in the hotel set up, and people go, oh, there's that guy that talks about birth defects and shows pictures. So I wanted to stop that. So now I'm showing you these pictures. I have groupings of pictures. At the upper left hand, you have this birth control pill. There's a man with a muscle and a patch, and there's the cholesterol medication. On the bottom left, there's alcohol, and there's a bartender or a waitress. In the middle, you have these athletics pictures, and then on the right is a picture with a baby breastfeeding and a hookah smoker and e-cigarettes. And these pictures, what I'll do is I'll incorporate them in the talk and kind of tie them in with the talk. But what I'm going to cover here now, and because I didn't include them, is the picture of the skydiving, surfing, hiking, and this weightlifting. And I think this weightlifting picture you might have just seen recently. It was in on the Today Show where this mom was lifting real heavy weights during pregnancy, and it just floored a lot of people, and had given her negative comments about the unsafeness of that process. But I had a mom who called, and she said she was very athletic. She knew about exercising and minimizing, because, you know, the concern with exercise is, or at least what concern had been generated was, when you're exercising, you should kind of take it easy, and in pregnancy, that is, and not raise your body temperature too high. So the woman said, oh, well, I'm going to cut down on my running, but I really like to surf, skydive, and hike. So she was more concerned about the temperature, body temperature, because of the running, and she didn't really want to discontinue any of the other three. I couldn't find any information on all these, but I think what the issue might be is that a lot of these could, especially the surfing and skydiving, could involve like vigorous pushing and pulling of muscles, and may be a concern. If you would like to know more about exercise, we do have a fact sheet on that, and on our website, and you can download that and read up more on that. So on the next slide, I just wanted to show you, I'll go over some background info. It's the causes of birth defects. And if you look at that, it's kind of interesting, because really birth defects teratogens only cause about 10% of birth defects. And really we can reduce that risk or eliminate it altogether by collaborating and educating our moms and our population about exposures in pregnancy and how to avoid them. Okay, and then in the next slide, if you go to, if you look at this, this is a human teratogens have been recognized, and we don't like to, well, I personally don't like passing it around because it can be misleading and interpreted, but I thought I'd show it up here, and I added some pictures, and I think this is the only slide I'm going to show you with pictures that of malformation. So real quick, if you go to the first, on the left-hand side, you see the first picture. That's actually a baby with a genetic problem or disorder called prune belly. But the reason why I put it up is cocaine has been associated with hydronephrosis or leading to renal distension. And that's what you might see with a cocaine-exposed baby. You don't always see that, but that has been reported. So that I thought I'd give you that so you can appreciate it. With cocaine, we know it's a suspect for risk from hydronephrosis, cerebral infarction, limb reduction, but we don't really know what the magnitude of the risks are. And one of the reasons why it's been hard to study, as you probably can imagine, is that cocaine is not controlled, and so there could be adulterated with many, many things. The next picture, if you see, is a profile of a child who actually did not survive. And if you look, he has this little pit kind of at the joint where the jaw ends. And that's a low-set ear, technically, but he does, I'm not sure if it's a he or she, doesn't have an ear. It's actually more like an ear dimple, not even a pit. And that's been associated with isotretinoin or Accutane. And Accutane actually is one of the worst drugs one could be exposed to during pregnancy, especially after the 15th day, because it's been associated with a 35% risk for birth defects, the Accutane embryopathy. The next picture is a picture of a kid with who had been exposed to Coumadin or warfarin, which is a blood thinner. I'll skip the heavy metal, and if you look on the right hand, you have the top picture is a child with fetal alcohol syndrome. The next child is a child with cleft lip or palate. With cigarette smoking, it used to be the concern predominantly were complications like miscarriages, low birth weight, prematurity. But now there's some evidence to show that with moms who have a specific genetic makeup, who also are heavy smokers, that they have a higher rate of this cleft lip or palate. And it's really specific. So, and it's heavy smokers. I think it's about a pack to a pack and a half a day. So it's not that we scare pregnant moms, but we certainly talk to them about it. And then we have a newborn with fetal herpes, congenital herpes syndrome, and then finally the last picture is a child with the fetal varicella syndrome, which is a chickenpox exposure, and that's associated with the limb reduction, skin scarring, hydrocephaly, which is a small head. And it used to be that people were told that that risk was as high as 15%, but that was based on isolated reports and small-scale study. We actually did a study here where moms who had, when there was an epidemic sometime in the 80s, where moms were calling regularly with, and I think it was before the chickenpox vaccine, moms were calling having an outbreak during pregnancy. So we encouraged them to do the mom and baby follow-up program. So we collected, I think, a little over 100 cases and followed these moms, and then after the baby's born, examined them. And we found 2 babies with mild, one had mild skin scarring and the other one had some eye problem. I think it was nystagmus. And then it corrected itself or resolved itself. So now we're saying, yes, there is a risk. We still believe there's a concern about, but we're not now, we're reassuring moms now that it's very low. It's about 1 to 2% should they have an outbreak within the first 20 weeks of pregnancy. All right, so the next slide. How does Mother to Baby California work with pregnant and breastfeeding moms and professionals like you? So, you know, in the, I think the WIC manual, under the certification process, there's this note or bullet that says that WIC is mandated to refer moms to other services. And that's how we've come into play. Years ago, we've approached the WIC at the state level, and we sampled it here at the Southern California, San Diego sites, and Imperial County, where we try to incorporate it in ISIS. It's actually, I think, on a page on ISIS where the referrals, and we're listed as, at least in the programs down here, we're listed under P, because back then it was the pregnancy health information line. But the moms, you know, people get referred to us, and then what happens is we, when they call, everyone's trained to just do reflective listening and building a rapport. We just let the moms vent. Let them ask their questions, say everything they're concerned about, and lay it out on the table, so to speak. And then when we're done, we say to the mom, okay, now it's our turn. We want to make sure we get a good picture of your pregnancy, because we don't want to be counseling you on Tylenol and reassuring you it's not a problem or not a concern, and then not know that you are drinking alcohol or smoking cigarettes or doing something that could potentially affect the pregnancy. So we do that. We then turn around and either call her back, put her on hold, and then when we talk to her, we have the conversation, we provide evidence-based information, and in doing all that, we incorporate the principles of teratology, where we're talking about genetic susceptibility, the time of exposure, like when did she take the medication, how much did she take, you know, is the medication even going to get to the baby because she's using it topically versus taking it orally? And when it's known to cause an effect, how does it affect the development, and like how severe can the effects be? I know that's a mouthful of words, but believe it or not, we can simplify that so that our moms can understand this in lay terms. Okay, we can certainly simplify it enough, but not too simplified that we're just giving them reassurance. And also, just to let you know, the fact sheets that we have used to be at a high school level, and many providers had complained because patients were having difficulty reading it. So now it's simplified to the best of our ability at the 8th grade level. All right, so that's how we work. So in doing so, I'll talk to you now about, incorporate about how things are talked about or counseled. So in the next slide, how many of you have seen the signs of Prop 65 warning? Okay, and that is a warning more for chemicals, and you used to only see it in bars, and then you saw it in parking garages because of carbon monoxide and all the soot that you get from the exhaust. And more recently, if you look at I'm sorry, it's not very clear, but right under the warning word, there's a Prop 65. That was actually a photo I took at Starbucks. And when I was buying coffee, I actually started to get concerned, and I thought, oh my goodness, what are we going to get surge of calls on? And you can't read it here, but what they're trying to warn people about is acrylamide. So, listen to that word. It sounds very ominous, acrylamide. And it's the chemical name. It's actually used in paper and other industries. And believe it or not, it's present in a small amount of food, especially those that are fried at high temperature, which is why you see the McDonald's sign has a warning, because you can get this in French fries, potato chips, sometimes grilled food. If anything that's roasted, they've seen acrylamide. So technically, it's not per se an issue, but because it could potentially cause other effects, not just reproductive, but carcinogenic effect is why it's in the Prop 65 or why they put it up. So, but the reason why I bring this up is, if your mom comes across this and is asking you about that, before you have them get too concerned, you want to get a handle on it and say it's a generic warning, and what you need to do to get it clarified is call or contact mother-to-baby CA so they can tell you what truly is known about the exposure. What I think is really interesting is at the bottom it says Prop 65 warning. I went to an Asian market, and interestingly, I saw the sign in just one aisle and not even in the store, just in that one aisle. So I was curious to know what it was, but a lot of those products were in different languages, so I couldn't tell. But I thought it was kind of interesting. So that's that. And again, so if you go to the next slide, it's a caffeine slide, and there's really no big issue with caffeine. But I put that up because of I was at Starbucks. And really now the bottom line with caffeine is, as long as the mom is minimizing her caffeine consumption, if she still continues to take it, is that according to ACOG, if you ingest 200 mg per day or milligrams per day or less, doesn't appear to be a contributing factor for miscarriage or preterm. I actually joke about this with a lot of our callers if I can, because I remind them that it is a stimulant, and that they should still minimize it or avoid it. And especially in the second half of the pregnancy when the baby moves a lot more, if you're taking the stimulation and the stimulant and the baby is, moves a lot more than, they metabolize it a lot slower than you and I do. So unless they want the fetus to be doing aerobics there, they want to minimize the exposure. All right, so the next slide, it's similar to the Prop 65 warning labeling for chemicals, but this one is more for medication. And historically, this is the quick and easy method that doctors used to use. They would open up the PDR or whatever reference, and they would say, oh, this drug is category B or category D, or in the worst case scenario, category X. And that was alarming because it scared a lot of people. And right now, it's been, I think it's finalized about 3 years ago, maybe 5. The FDA is going to get rid of this labeling and somehow put a dialogue, if you will, of the information specific to the drug in the drug insert so that they can't just use A, B, C, D, or X. And that's really what we do here. When a mom calls about a medication, we talk about exposure, and then we talk to them about what the studies have shown rather than just saying, oh, yeah, it's a D, X, or A, or B. Okay? If they ever address the issue of the categorization, we explain to them what that means and how that applies to the data. Okay? So on the next slide, an example of these category A, B, C, D, or X, you see this pictures of cholesterol and cholesterol medication, Lipitor, Crestor. And if you go to the next slide, where it says statins first trimester exposure, it's classified as pregnancy category X. Interestingly, well, and why it's such an kind of an issue, if you will, is because a lot of moms now are having pregnancy at the later end of their reproductive age. And then also that about 50% of pregnancies are unplanned. So if moms have exposure to this, there's a potential that it can cause birth defect. And what generated this concern was this FDA adverse event reporting. But when you look at the actual collection of data, they have not seen an increased risk or anything to conclude that. But the reason why it's contraindicated in pregnancy is more from a mechanistic standpoint. It's the fact that cholesterol is essential for normal fetal development, and the idea is if you're taking anti-hyperlipidemic, then you could affect your cholesterol production, which then affects production of hormones or things necessary for the fetal development, even though it's never been proven or shown to cause an effect. So the thing about the statin is because it's for a disease or condition that's not too emergent, if you will, women are told to just go ahead and avoid it during the pregnancy for 9 months and then perhaps continue it after pregnancy. And speaking of cholesterol, if you go to the next slide, this is your first batch of pictures with the testosterone. Testosterone is an androgenic hormone. It may affect the development of external genitalia, but it is important for the development of the fetus. Now, the reason why I put this up is we had a mom who called us. She was an IVF, in vitro fertilization mom, or involved in IVF, and she had gone to an expert in, I think, Colorado or somewhere there, and had a question. She was an infertility patient and taking testosterone because if you go to the next slide, you know, testosterone is, we produce it in our body. It's important for sexual maturation, but it can also be synthetically prepared from cholesterol and given for many reasons, from low testosterone in men, but in fertility, there are fertility clinics across the country now that are beginning to administer this in gel or patch form. And the idea is it's supposed to help the number of eggs produced by certain women undergoing IVF. But the ironic thing is they say you could use this, but don't get pregnant on it. And apparently this mom had been exposed within a few days prior to her getting pregnant. And so their thought was, well, then it's going to be a concern. And also because it's category X, it had generated major concern. And also she was told by her reproductive specialist that if I were you, I would not follow through with this pregnancy. And here they've been trying and spent money from LA to go to Denver or Colorado to get this done. So back and forth, they've called us, we've looked at all the data, and they were so concerned about this defect. And the picture I've shown you previously is there's an ambiguous genitalia there. Now, the issue with testosterone is affecting female babies, and during the progression or the development of the external genitalia. Okay, and you know the external genitalia doesn't even develop till about 8 weeks. We are basically in a sexless stage during the first few weeks of pregnancy, and then at a certain time, because of our genetics, it triggers the hormone that starts to influence the formation of external genitalia. So if that mom had been carrying a female fetus and was exposed at starting at the 8th week for prolonged periods, there could have been possibly masculinization of the female fetus. And really that translates to it affected the external genitalia, not other psychosocial issues. But because of the scare, this woman and the mom and the father of the baby were so scared they didn't know what to do. After many months of talking back and forth, they decided to follow through the pregnancy, and on December 25th, of course we were not here in the office, but we were sent a picture of their baby, and the baby is doing fine and normal. So, the neat thing is we end up saving a lot of wanted pregnancies by giving them moms good information. I'm going to speed it up a little bit because I have a few more slides I want to cover. So, this, can you imagine this? The caller and the husband were so concerned that her anxiety level was probably very high, and then also imagine if she actually did have anxiety problems. So if you go to the next slide, that's one of the things that we get a lot of questions on mental health illnesses, depression, bipolar disorder, anxiety, and the medications associated with that or taken for that. If you go to the next slide, the one that we do get a tremendous amount of calls, not only in California but nationwide, is on the SSRIs, the Prozac, Alexa, Paxil. But the neat thing so far is they are the drug category that's been studied the most. The data is not clear in terms of a major malformation, but certainly not a pattern that's been seen. Of the group, Paxil or paroxetine is one that still kind of is questionable because of a couple of studies that suggest that may be a concern for cardiovascular effects, but not quite conclusive based on other epidemiologic studies. What seems to be the issue with this SSRIs is when they're used late in pregnancy, because they can cause withdrawal effects or even respiratory problems. And for more details on that, certainly you can call us or contact us on that. If you go to the next slide, one of the things that I think moms have to focus on, or at least providers have to focus on, is that when you have a mom who's doing other things like smoking, maybe they have poor nutrition, maybe substance abusing, is that they could have a mental health issue that's not diagnosed, and therefore they're not taking the being treated for it, which is then causing the other comorbidities. And so that's something we take in consideration, where we look at when we have a mom who's talking about an exposure, we make sure that we ask other conditions. So in the next slide is just an example of substance abuse, I think on your on the WIC manual, there, how you're mandated to have a drug alcohol training on alcohol and drug abuse training, and I actually do that for a lot of WIC sites, especially in the Southern California site, where I go annually to talk to them about substance abuse during pregnancy. So that's something that we may be able to do for your services if it's not something you've done or I've done at your site. If you go to the next slide, I think this is the one that's most interesting, is how to get drunk without drinking. Okay, so you look at that and you think, what's going on here? What's the issue? And the scenario really is, it was a referred call from our community partner, the California Smokers Helpline. And what it is that a mom was living in a household where everyone's smoking, and she was too, and she wanted to quit smoking, so she called Smokers Helpline. But what she didn't want to do was quit her drinking. Now, none of her family members knew she was drinking because she hid her drinking, and how she did it was she would soak the tampon in the alcohol, and then she would insert it vaginally. So, that it turns out that that's a common practice in some colleges across the country, and they get the buzz. They don't get the breath, and it bypasses the liver, and so that they're getting the alcohol. Problem is, we don't know what blood alcohol level results in that, and so we have no idea like what the risk could be or how much. So that was a question, a real interesting scenario for us. So the next slide, if you know, just to kind of review again or add more things to what I mentioned earlier about fetal alcohol syndrome, you see an illustration of the fetal alcohol syndrome features of it, the facial features. If you go to the next slide, it's just background info. It's and that's how we categorize risky drinking. Nothing too different. And then if you go to the next slide, the variation of the palmar creases. This, I think, is kind of interesting because these creases, if you see on the left-hand side, is commonly seen or has been seen in kids with fetal alcohol syndrome and it's found in 10% of the population. But why that happens with kids with FAS, we have no idea because of the way the hand moves and the way, perhaps the way the brain has been affected. So the next slide, the next few slides just summarize what we know about alcohol, what we've learned in the 37 years that there's a specific pattern that's established. You know, animal models do give us more information, even though it doesn't tell us how it can happen per se in humans. There are risk factors that have been identified, and a number of neurobehavioral abnormalities have been seen. And on the next slide, we'll just list the types of neurobehavioral abnormalities. So now just to cover the mother-to-baby California, so I'll give you a few minutes for question, is the mother-to-baby follow-up program. It's an observational follow-up. It's not a clinical trial. We don't tell people that they should take their medication. We don't tell them to stop it because they need to talk to the doctor about that. We collect information from them, pretty much what you do, or similar to what you might do. We have a relatively low follow-up because we really keep in touch with these moms. And then we evaluate them at after the baby's been born. If you go to the next slide, that's the conceptual model of how our program is done. If you notice on that model, it says mother-to-baby California on the left and the bottom, and then mother-to-baby Otis pregnancy study. What happens is we are doing studies on California on anything and everything that we possibly can so we can collect data. And that really just means that if somebody calls about an exposure, we want to follow them. But if they have an exposure specific to what the research projects are doing at the national level, then when we can refer them there. And that's where Otis comes into play. So which is on the next slide. Otis is basically what we are about, but Otis is at the national level. They provide information to folks in North America who don't have a teratogen service, and then they also talk to them about the research projects. So if you go to the next slide, that's just an example of a study that they are in the process of doing. Vaccines and medication and pregnancy surveillance is actually a federally funded study through BARDA and AHRQ, and it's looking at moms who were vaccinated in pregnancy. And it's just to further validate that, as far as we know, that with vaccination, especially with the flu, that it's not known to increase the risk to the pregnancy. You know, one of the difficulties about the vaccine is how or what people perceive about vaccination, because of all the misinformation that's been floating around or confusion. In fact, if you go to the next slide, you know, you talk about risk perception. You look at the caption. This was in 2004, and here, if you could read it, it's a mom who is worried about the effect of the jackhammer noise on her unborn baby. But yet, if you look at her finger, she's smoking, and that's probably more an issue than the jackhammer noise. Now, not in the next slide, not only do we promote healthy pregnancy, but we also promote healthier babies. We are pro-breastfeeding, and when we get questions from moms and provider, what we do is ask details of the exposure, very similar to what we do with pregnant moms. And then in our assessment, we use a variety of resources from LacMed to drugs, pregnancy, and lactation, reproductive toxicology, breastfeeding and medication with Thomas Hale's book or online. And then we then give them the assessment. This slide, the next slide on the smoking and lactation, It's just we've had questions more commonly now on the hookah and the e-cigarettes, and it's pretty much explained here. But there are two different issues. With the hookah, it's the carbon monoxide, but more on the health effect on the mom rather than the baby, whereas with the e-cigarettes, they are getting some nicotine in that. The problem is some e-cigarettes don't have nicotine. Some of them have more than normal, and because they're not regulated by the FDA, so that certainly may make a difference in how much is getting into the breast milk. The next few slides are alcohol and lactation, which I think most of you may already be familiar with, so I'm not going to go into detail. I just thought the first slide here where it's mom jailed for breastfeeding while drinking. An interesting scenario was back in May. I think she was in Arkansas, and I can't remember, or Tennessee, one or the other. And it was a confusion, and why she was arrested was more because of the confusion about endangering children, because she had other children with them besides, I think, her 6-month-old that she was breastfeeding while they were having dinner. So the next few slides after that is just on alcohol and lactation. So the slide, I can't see what number this is, why call Mother to Baby California? Because we do care about moms and their babies. We get more than 100,000 calls a month or a year from all over the country. We answer all sorts of questions. On the next slide, we provide a benefit not only for you, but also for your pregnant, breastfeeding, and planning pregnancy moms. We reduce calls to clinics. We get people who call us every day about sometimes even a simple thing like drinking lemonade that may have been tainted with pesticide that was applied, 2 years ago. We support physician care plans. We clarify a lot of misconceptions. We promote healthy behavioral choices like you do, where we make sure that they're taking their vitamins and eating healthy, and we preserve a lot of wanted pregnancy. So in the next few slides, if you look at them, it's just a copy of a picture of our website, and there's a picture, just a screenshot of our fact sheet page, and there's, I think you may have already seen this before, floating around. You can download these, and it's at least enough to give the moms some information about exposure. The second to the last slide, another healthy baby. So here's a baby born to a mom who, the medication she was on, during clinical trials, there were 10 moms who had gotten pregnant inadvertently while on the drug. And it's a rheumatoid arthritis drug, and they all aborted their pregnancies because of animal data, where it said it caused severe malformation. So when it made it on the market, we were approached by the pharmaceutical company to do a post-marketing surveillance. So we just track moms who inadvertently get pregnant on this. And so far, we've been able to collect over 100 cases, or close to that, and we have not seen any babies with anything glaring in terms of structural effects. So it's kind of reassuring now. It's not enough to say that the drug is safe. Certainly we still work with the moms in terms of how to chelate and eliminate it and all that, but it's at least reassuring that so far what we've seen is nothing glaring in terms of negative effects. Finally, here's our slide, Mother to Baby California. We answer questions about planning a pregnancy, pregnant, or breastfeeding. You can call us on the toll-free number or reach us on the website. If you call us and you get a voicemail, it means all the counselors are busy. But if you leave us a specific, then we can do the research so that by the time we call you back, we have the information at hand. All right, I think that concludes it. I've covered a lot. Certainly, you can also email me if you have any questions. I don't think I included my email. It's rfelix@ucsd.edu, or you can go to our website and email us your question. Thank you.
Fabulous, Robert. That is a lot of information, but luckily you told us throughout where we can go get more information. So that's what we're really here for, is to give people a taste of what's available in the way of evidence-based information on this topic, and I think you've done a good job of that, so thank you. We'll take a few minutes for questions. If you need to leave, we understand because it's almost the hour is up, but I'm sure if you're also welcome to stay on. The webinar does not go away until we say so. So I will read you a few questions, and hopefully these will be helpful. But again, you can contact Robert at rfelix@ucsd.edu if you have any questions, or go to the mothertobabyca.org website. Couple quick questions, hopefully. Is the mother-to-baby phone line, can it be promoted to WIC participants in states other than California?
Yes, thank you for asking. That's great. About 2 years ago, we had an 800 number that was only specific to California. But if anyone called the national line and they were from California, it would get routed to us. But now, anywhere in the country, regardless of where you're, in North America that is, if you call the 800 number, you will get routed to the service in your state. And if you are not, if you don't have a service in your state, you will get routed to the service that's providing service to your state. So, for example, Washington State has lost their service because of our fundings are disappearing. We are taking care of calls from Washington State, Oregon, Hawaii, Puerto Rico, Guam, and California. There may be more, I'm not sure. But yes, regardless of where we are, and use that same number, 866-626-6847, and it will route you to a service.
Great, thank you. There's several questions coming in that were answered at the beginning, but maybe you didn't hear it. These slides and the recording of the webinar will be available on the CWA website in a day or two. Several questions about services available in languages other than English.
We have, especially in the California side, we have bilingual counselors in Spanish. Oftentimes I'll do one in Tagalog with Filipino language. Depending on the need, even though we are not, quote, part of UCSD healthcare system, we can do translation system. We have tried. It's not always great, but we can do that. And then depending on what language, we might be able to contact other services throughout the country who have a counselor who speaks that language that is necessary. So we can try. Otherwise, what we do is request that the participant or the mom have someone in their family who can translate for them.
Excellent, thank you. Now, there are a lot of questions. I'm trying to sort through them here.
And then you can send me those questions, and I can answer those as well, too.
Excellent. Yes, I will do that. So I will send your questions to Robert, and he can answer them. But some that people might be interested in are having to do with breastfeeding in particular, and I don't think you really had time to give that the attention that you might have intended originally, Robert. But somebody asked about mentioning that breastfeeding has an entirely different set of risk levels than pregnancy.
Correct.
Okay. So just to clarify that, and somebody mentioned wanting to know whether methadone or Ventolin are okay during breastfeeding.
Okay, I don't know that off the top of my head.
Okay.
And at the computer I'm at,
right?
Yeah, at the computer I'm at, I don't have. Otherwise, I would look it up and tell you what we have on that. But we do have that information, and like the risk categorization, I guess you will, for pregnancy, we're also cautious with that when it comes to breastfeeding.
Mm-hmm.
So sometimes these medications have, like I forget what the categories are in Tom Hale's book, but they, whether it's Tom Hale's or LacMed or whatever resource, we don't always just go by one. We actually check all the resources, because depending on the time of the year that we're getting a call or when, that sometimes the information hasn't been updated on one or few of the other resources. So we want to make sure it's comprehensive, and that's why we don't always go by the labeling. We go with what is currently in the medical literature regarding that drug and breastfeeding. So if you, I'm not familiar with the categorization, so I don't always talk about it, but we certainly can address it when we're talking to the provider or the mom about it.
Right.
I don't know if I've answered that question or not.
We'll find out if somebody contacts you with. Oh, here's an interesting one. Is this service anonymous?
Yes. Now, some are even more anonymous than others. California, for example, used to be truly anonymous. We would just ask for first name to call them by and just the details of the pregnancy. But because of the funding source or the issue, we are now required to ask demographics, which is still not quite identifiable. I mean, they can give us a bogus name, but at least what we're asking for are maternal characteristics, so where they're at in terms of pregnancy history. We're asking about the zip code of their home so that we know the geographical area. We ask who might refer them so we know who's using the service or getting access to it. And that's the extent of, I guess you could say, identifier, but it's truly anonymous. And if the mom does not want to give the information, then so be it. We don't collect it. We just answer the question. But we always say that the only way we can get them to really, the way we could get them information is if they truly give us the exposure information correctly, or as best they can.
Okay. We do have some other questions, but many of them are very specific. So I think we'll wrap up with respect to everyone's time availability today. Thank you again, Robert.
Oh, sure, and please, I will answer any of those specifics as best I can. Email it to me if that's probably the easier way.
Great.
And then if you think it's something that can be shared on the site so everyone can benefit from the answer, then why not?
Sure. Thank you. And just a reminder that the slides will be available for download as well as a recording you can listen to again on our website in the next day or so.
And then one last thing that I didn't cover, sorry, real quick in 1 minute, is we have a variety of ways you can refer your mom. And we also have a script for how you can refer your mom. So for example, the WIC American Red Cross, they said, how can we reassure our participants that we're referring them from one warm place to another? So we came up with a script with that. So they can do a warm transfer. That's one way. You can go to the website and do an e-referral. It's electronic. It's anonymous. It's encrypted. In fact, we can't even see it. We have to log on to another database to get that specific information. There's a fax referral, which I think is one more step for everyone, which a lot of the sites here in Southern California don't want to do because it's more paperwork. So there are ways around it. I didn't describe the whole thing, different variety, but if they have specifics about what they think would work at their site, they can contact me and we can work it out.
That's very helpful. Thank you, Robert. And thank you all for joining us. We will have another WIC Works webinar each of the next 2 Wednesdays, so please check our website and announcements, and we hope you'll join us again. Thanks, everybody.
Thank you, everyone.